Hi you guys, welcome back to my channel. So today I wanted to film a video about the pros and cons of working in a hospital. So as I've explained in previous videos, I've been a nurse for 7 years. 6 years I did in long-term care and like a nursing home, and then the past year I've worked at two different hospitals. So I did like 6 months at one hospital and then the rest at a different hospital. So I've only been working in a hospital for about a year, so a lot of my experience is more in the nursing home. So this is just like my quick little pros and cons of working in a hospital, what I know so far. So the pros, in my opinion, is that you have more resources, meaning in a hospital you have more nurses who are working with you. They're everywhere. So if you have questions, if you have a patient that's going down, that's crashing, if you're just unsure about an order, something doc wants you to do, you've never done that before, there's so many other nurses around that can help you, and you can bump ideas off of. The other pro is that doctors are there. Doctors are everywhere. So you are able to ask some questions and get your question answered straight away. Working in a nursing home, you don't get that. Working in a nursing home, you may not have another nurse that you may be able to work with. It's harder to, get help. So you have more doctors, you have more nurses. Also, if you have questions about labs, you can call the lab, call the lab and ask them. Another thing I love is that if we have questions about medications or if meds are compatible with each other, you could just call the pharmacist. If you have a question about it being scheduled at a certain time, anything, if you feel the dose is weird, anything, you can call the pharmacist. And also the pharmacist is another backup, because as we know as nurses, when a doctor orders something, we as nurses have to catch it if the dose is wrong, or if it's not right. So it's nice having a pharmacist who's also doing that. They're also double checking what the doctor ordered, and sometimes you will see that the medication, the dose, or the timing may be changed by the pharmacist, so that you didn't even need to catch that or worry about it. So that's nice, extra backup. The other thing I like as far as having more resources is the respiratory therapist. Anytime your patient is having any type of respiratory issue, you can call respiratory and they come up and specifically they deal with that. And that is amazing and awesome, because we know how important oxygenation is for our patients. So it's amazing when your patient is desatting, you can call respiratory and they come up and they deal with it. And they get their orders, they put them in, they do all that. So that's awesome. So that was my second point, was having more team members to help, specifically respiratory therapists. It's awesome it's awesome having them there. And then like if your patient is on mechanical ventilators, CPAP, BiPAP, whatever, and you don't know how to use it, or the machine is malfunctioning, call respiratory and they come up and they fix those issues. So that's very nice. Another pro about working in hospital is that you get less patients. In a nursing home, I know my nursing home, the lowest I had was about 50 at all times. That's a lot of people. That's a lot of patients. In a hospital, depending on what unit, what area you're in, you can have 2, or you can have upwards of 7 or 8. 7 or 8 is a lot. That's a lot when you're in a hospital setting. That is a lot, but it is less than 40 and 50. So, you get less patients. Another pro is that working in a hospital, the nursing is considered 24 hours. What you can't get done in your shift will be carried over into the next shift. You try to do as much of those doctor's orders as you can, but if you cannot get it all done, then it goes over into the next shift, and it just is what it is. And people generally don't get upset or mad at you about that. It's pretty understood that, I couldn't get this done in my 12 hours. We need this specific specimen, and like a sputum specimen, well, if the patient isn't coughing or they're unable to bring up that sputum, well, that goes over into the next shift, and maybe even the next shift after that. But, it's understood that, yeah, it just didn't happen in my 12 hours. So, and it's okay. versus, you know, in a nursing home, you have the list of things you need to do and you need to get it done um, on that shift. Um, Another pro is you have more variety in patients. You have obviously in the hospital you have more turnover. People are being discharged, and they may need to be moved to a different unit if they need higher or lower care, depending on their acuity. So you get to see a lot of different type of patients. Also, depending on the type of unit you are, you may see more variety in diseases and, you know, patients in various stages of those diseases. So that's nice. If you work on a med surg, you'll see everything. At my hospital that I work at, I float, so I'll make a video about float nursing and all that. But um, like on our cardiac floor, we have cardiac, we have stroke, we have, you know, we have it all. And so I'm able to see a lot. So that's nice. And again, people at various stages of the disease process, which is pretty cool. Um, Also, with the whole variety in patients and more turnover, if you have an annoying patient, they may be gone by your next shift, you know, and you're also able to refuse that patient. You're able to go on to your charge of, nope, I need to be switched, or the next day when you go on, you could tell them, I don't want that patient again. Like, I'm back tonight and I don't want that person again, and you don't have to have them again. Versus a nursing home, you have to deal with those patients, period. And mostly no patient is leaving the nursing home unless they're moving to another nursing home or going to go live with one of their children. Most of them will die there, so you have to deal with that patient until death. So in a hospital, it's pretty cool. If you have an annoying or really difficult patient, you don't really have to keep dealing with them. So that's nice. Another pro is more teaching. There's lots of teaching available in the hospital. They're always having you go to classes and recertifying, and there's always we call them edunets, but little education things you have to do online to just make sure you're staying on top of the things. Sometimes it's a little annoying because you're like, oh, I already know this, but it's good to, you know, always refresh your memory. So lots of teaching available. Also, work in a hospital, you do work less days, especially if you're in nursing. We work less days, work 3 days a week. More hours, which is a con. It could be a con, but we do work less days. We work 3 days, you get 4 days off, so that's pretty cool. The other pro is there's more money. At least in my experience, I found that hospitals, they just pay more than nursing homes or clinics. They just do. In a hospital, you really do get paid more. You get paid closer to what you deserve. I think nurses should get paid more, just my opinion. But at least in a hospital, you are getting paid closer to what we deserve. And also, there's lots of overtime that I found, especially in my hospital. Lots of opportunity for overtime. Now, some cons of working in a hospital. In my opinion, I feel like it is harder physically on the nurse. Nurses do more in a hospital versus in a nursing home. In nursing home, you have a lot more help from your CNAs. They, you know, they toilet, they feed, they, you know, get them ready for bed, wash them up, change the bed. You know, they do all of that in the nursing home. And the nurse really, like, the nurse, it's rare that you would see a nurse in there washing a patient up and getting them ready for bed. That really is more of the CNA job. However, here in the hospital, you will see that all the time. Nurses are often the ones doing that toileting and, you know, bringing in things like water, washing our patients up, showering them, changing, doing bed changes. Nurses mainly do that. CNAs do it as well, but you would definitely see nurses doing it as well, because the CNAs, sometimes you only have one CNA for the whole unit, and they're busy. They're very, very busy, and so we can't just sit and wait and be like, okay, well, you know, I know you need to use the bathroom, but you have to wait for CNA. Like, no, CNA is very busy. So yeah. And then depending on some units, the CNAs will take your vitals. Some units they don't. So it's helpful if CNAs can take the vitals for you, but you know, some units they don't. Especially, you know, the more specialized or higher acuity, they want the nurses to do it themselves. Another kind, like I said before, is the longer hours. Usually in nursing home, you're going to work about 8 hours a day. Here in the hospital, you're working 12 and a half. They say 12, it's 12 and a half. And you're lucky if you get out after your 12 and a half. You usually don't. So it is long hours, very long hours. The other kind is things, your tasks that need to be done are required more quickly versus like in a nursing home. If there's a lab or something that needs to be done in a nursing home, you may have days or whatever to get it, versus here in hospital, it's a lot of things are timed and you need to get it done quickly. So tests, labs, your documentation, you don't document it, you will forget it. If you didn't document it, you didn't do it. So those things are timed. You have to get it done. You don't have a lot of time to do it. Another con is you get lots of phone calls. Everything is going through you. You have family members calling you. You have lab, doctors, other nurses. You have, like if you're on a telemetry unit, you have the tele people calling you about your patients. If your patients is like being monitored, safety monitor and all that. I know my hospital, we have cameras in the room, and there's someone in another area who's watching that patient, making sure they're not getting out of bed on their own, or just that they're being safe in there. So you get lots of calls from them as well. So your phone is constantly ringing. So that's a con of working in a hospital, because it definitely isn't like that in a nursing home. Another con could be having to call doctors, especially at night, having to wake them up and deal with grumpy docs. I'm happy to say this hospital that I'm at right now, I've been pleasantly surprised the doctors haven't been that bad at all, so that's awesome. But yeah, that can be a con. You do have to work with doctors. You will be calling a doctor at least once on your shift. It just has to happen. Another con could be if you work days, that all those multiple team members are making rounds on your patient, which requires you to be in the room to know what's going on. It's like docs coming in and like dietary, case management, physical therapy, clergy, pastoral, people coming in there. So it's a lot. It takes up the time. You want to do things for your patient, get your tests done, but the doc is in there talking to them. You can't really toilet or wash them up while the doc is in there. So you have to wait. So it can really mess up your time. So another con, I said, as far as like the longer hours, again, you may not leave on time. It says you can get off after your 12 and a half hours. That's rare. So that's another con, because it happens a lot. Another con is the documentation. You document so much on these hospital patients, and I'm going to make a video specifically about all the documentation requirements. It's ridiculous. But documentation, it takes up, I think documenting takes up more time than actual patient care, which I don't think it's right. But yeah, I definitely spend more time on the computer documenting about my patient than I am in the room with the patient mostly. Another con is that your patients are more likely to crash more often, go downhill. When you're in a nursing home, a lot of those patients are DNRs, do not resuscitate. You already know that they're dying. It's kind of expected. It's just not, they're not going to like have a heart attack or a stroke just like randomly, like every day, versus in a hospital, your patient they can go downhill just like that. And it happens more often. So that can be really stressful. And then the last con that I have is that with those various patients, while it's nice if you don't like them, it's also kind of a con because you don't really get a chance to get to know them. You don't get to really form a lot of bonds with your patients. So if you're that kind of person who likes to have that kind of connection with your patients, unfortunately you don't get that a lot, especially if that patient is gone like the next day. If you get your patient like on your 3 days that you're working, you will have, obviously you'll be able to form more bonds more easily that way, but it's pretty rare that you really get to go in depth with your patients. You really do forget them. Like the next week that goes by, you really do forget who you had. So Yeah, so those are just my quick little list of some pros and cons that I have found at working in a hospital so far. And I'm sure once I've been there longer, I'll be able to add to that list. So let me know your thoughts. If you work in a hospital, what are your thoughts? Do you agree? Do you not agree? Yeah, let me know. All right, thanks, guys. Bye.